COVID vaccine booster shots are now available for nearly 100 million Americans. CDC Director Dr. Rochelle Walensky backed an advisory panel's recommendation to authorize Moderna and Johnson & Johnson boosters. Anyone 18 and older who received the J&J vaccine can now get a booster 2 months after their initial shot. Those who received the Moderna vaccine at least 6 months ago can get a booster shot if they're 65 and up or at high risk of infection. The CDC also said it is okay to mix and match different vaccines. Dr. Rochelle Walensky joins us now from Atlanta, where the CDC is headquartered. Dr. Walensky, good morning to you.
Good morning.
Big day. Glad to have you here. Big day for booster shot news. I want to ask you about the rollout, what it will look like, and also if you could clarify, when the CDC authorizes something, does that mean it's also recommended? In other words, you can get a booster, should you?
Good morning. I want to articulate what an important next step this is for our booster plan, because we now have a plan for boosters for all 3 of our COVID-19 vaccines. You outlined the eligibility for Moderna recipients, the same as Pfizer. If you've more than 6 months out of your last shot and you're over the age of 65 or high risk from underlying conditions or by virtue of where you live or work. And also for Pfizer recipients, the 15 million Pfizer recipients, they are eligible for a booster if they got their last dose, if they got their only dose more than 2 months ago. And then, of course, this important issue of mix and match. Some people may prefer to get the vaccine that they got initially and did really well with. Others now may prefer to get another vaccine, and the CDC now allows for that mix and match option. We have distinct recommendations. We do recommend that you do get your booster if you're received the Johnson & Johnson vaccine, or if you have, if you're over 65 and you receive the Moderna or Pfizer vaccine, or if you have underlying medical conditions and you're over 50. We make you eligible to receive a booster by virtue of where you live or work. So there are some subtleties as to whether we highly recommend it or we just say eligibility, but all of those populations are now eligible.
Got it. Doctor, one of the subtleties is the definition of a high-risk setting. So the boosters are approved for people in a high-risk setting. What is such a setting?
So high-risk settings really do consider where you live and where you work. So if you are working in a frontline capacity, or if you're a grocery store worker, a police officer, healthcare worker, or if you live in a homeless shelter or a prison setting, those are the kinds of settings, and we have a whole list of those settings on our CDC website.
Looking ahead to November, when we could see an approval for vaccines, the initial round for kids as young as 5 to 11, looking at some polls, parents seem to be making a different calculation than they did for themselves when they think about their kids. And I think that's probably because kids seem to be less susceptible to severe illness. Speaking to parents, and getting ahead of the approval here, but speaking to parents who are skeptical, what should they know about that calculation when it comes to vaccinating their younger kids?
First of all, I just want to say how wonderful it will be when and if we have FDA authorization and CDC recommendations for vaccines for children between the ages of 5 to 11. We have recent data that demonstrates that children with the Delta variant are just as likely to get sick or get infected with Delta, although they may be less likely to get have severe symptoms. We are still seeing a lot of hospitalizations with the Delta variant and children. And when and if we have this authorization and recommendations, we will be talking to parents about the importance of pediatric vaccination. I do want to say that the parents, many parents in surveys are really, really excited to be able to get their kids vaccinated. And we have seen over time comfort with vaccines with more and more rollout. We saw that with adults. We anticipate we will see that increased uptake with children as well.
All right. Booster shots overall now available to nearly 100 million Americans. A big day. Dr. Rochelle Walensky, thank you for walking us through it.
Thank you so much. And for those 63 million who haven't yet been vaccinated, please go get your vaccine.
No better time than the present. All right. Thank you.